Hello, my friend. Thank you for joining us in this presentation. Today, I will be talking about the lumbar spine, a key part of the vertebral column. The spine provides structural support for the entire body, allowing us to stand upright and maintain balance. It also surrounds and protects the spinal cord and spinal nerve, which are essential for transmitting signal between the brain and the rest of the body. In addition to that, the spine enables flexibility and movement. It allows us to walk, bend, twist, and perform wide range of activities. When we talk about the lumbar spine, it is a vital structural region of the vertebral column, located in the lower back between the thoracic spine and the sacrum. It consists of 5 vertebrae, and we can call it from L1 to L5, and it is designed to bear the majority of the body weight. Because of this, the lumbar vertebrae are the largest and the strongest in the spine. They are responsible for maintaining posture, supporting trunk stability, and enable flexible movement such as bending, lifting, and twisting. At the same time, it protects the spinal cord and cauda equina, which run through the vertebral canal. In this presentation, we will look at the lumbar spine not only as a structural unit, but also from functional and clinical perspective, highlighting how its anatomy support its complex role in movement and protection. Lumbar spine is located in the lower back position between the thoracic spine above and the sacrum below. This region consists of 5 vertebrae labeled as L1 through L5, which gradually increase in size from the top to bottom to accommodate the increasing load of body weight. One of main function is weight bearing. The lumbar spine support the upper body, including the head, arms, and trunk, and transfer the weight down to the pelvis and lower limb. Another crucial function is shock absorption. The intervertebral discs between each lumbar vertebra act like cushion. They absorb compressive forces during activities such as walking, jumping, or lifting. This protects both the spine and the internal organ from impact. In terms of mobility, the lumbar spine allows for forward and backward bending, as we know as flexion and extension, set bending, lateral flexion, and limited rotation. This combination of strength and flexibility makes the lumbar region essential for everyday movement and function. Let's look at the typical lumbar vertebra. The lumbar vertebra are known for being the largest and strongest in the entire vertebral column. This is because they play a critical role in supporting the body weight and allowing for both strength and flexibility in movement. A typical lumbar vertebra has several key anatomical features. First is the vertebral body. This is the thick block-like structure at the front of the vertebra. It is the main weight-bearing component, and its size increases progressively from L1 to L5. On this slide, we are looking at the superior top-down view and the lateral side view of the typical lumbar vertebra. These two perspectives give us a clearer understanding of how each part of the vertebra is arranged and how it functions within the spinal column. From the superior view, we can see the broad and kidney-shaped vertebral body, which is the main structure responsible for bearing weight. At the back of the vertebral body is the vertebral foramen, which form part of the vertebral canal that houses and protects the spinal cord, or in the lower lumbar level, the cauda equina. We look at the extending from the vertebral arch are the pedicle, which connect the body to the posterior element. From the pedicle, we see transverse process projecting out to the side. This serves as attachment point for muscle and ligament, especially those involved in lateral flexion and trunk stability. At the center of the posterior arch is the spinous process, which project backward. In the superior view, we see how it's aligned centrally, forming a ridge you can actually feel at the back of your spine. The articular process, both superior and inferior, are also visible from the top. This articulate with adjacent vertebra, forming facet joint that help control the motion of the spine. In the lumbar region, these joints are oriented to allow flexion and extension while limiting the rotational movement. From the lateral view, we can appreciate the curvature and alignment of the vertebral body with the arc. The intervertebral disc space is seen clearly between adjacent vertebral bodies, showing how cushioning is provided between bones. The side view also highlight the orientation of the facet joint, slope more vertically in the lumbar spine compared to the thoracic spine. Again, this is important for allowing forward and backward motion while restricting twisting. Now, we go to the next slide. In this slide, we will explore the normal, curvature, and alignment of the lumbar spine. These two elements are essential for maintaining posture, balance, and spinal health. First, let's talk about normal lumbar curvature. The lumbar spine naturally curve inward, forming what we call lordosis. This lordotic curve play a crucial role in distributing mechanical loads across the spine, especially when we stand, walk, or lift objects. This inward curvature act like a spring. It absorbs shock and help reduce the strain on spinal disc, muscle, and ligament. Without this curve, the spine will be more rigid and more prone to injury due to uneven pressure. Next, we consider the spinal alignment. In healthy spine, the head should align directly above the pelvis, forming a vertical line. This alignment allows the body to maintain an upright position with minimal muscular effort. Proper alignment is maintained through the interaction of the all spine curve, cervical lordosis, thoracic kyphosis, and lumbar lordosis. This natural curve act together to keep the center of the gravity balance over base of support, which is the pelvis and feet. When lumbar alignment is disrupted, for example, in conditions like hyperlordosis or loss of lordosis, it can lead to poor posture, back pain, or even long-term spinal disorder.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Fariduddin bin Muhammad Saleh. I'm from medical imaging students for degree holder in PJJ. I would like to present about biomechanical in lumbar. As we know, what's mean by biomechanical? Biomechanical means for bio is life, and mechanicals is movement or force. So biomechanicals in lumbar is to study how lower back, which is lumbar spine, functioning mechanically to support body movement, posture, and weight while interacting with muscle, bone, joints, and gravity. Range of movement for the lumbar x-ray is able to move in different direction, which is like flexions, extensions, lateral flexions, or rotation, which is the twisting ligament due to joint orientations. Most movement occur at level L4, L5, and L5S1, but orientation is restricted by the orientation of the facet joint. They are movement vertically. We can see actually the videos. This is the videos of the movement of the lumbar. This one we can see the lumbar is bend, lateral flexions, and this one we can see the lumbar was rotate twisting, and then this one we can see the flexion and extension for the lumbar. For the stability, the lumbar spine able to remain aligned and control excessive movement while bearing loads. Structure involved, which is ligaments, such as ligamentum flavum and anterior or posterior longitudinal ligaments. Stabilizing muscles like multifidus and transverse abdominis intervertebral discs help to maintain alignment and act as cushions. When stability is lost due to injury, degeneration, or weak core muscle, it can lead to lumbar instability and chronic back pain. So In this image, we can see the transverse abdominals muscle and multifidus muscles here, and then the erector spine lah, here. So the muscles was connected and to build the stability of the lumbar area. For the weight bearing, the lumbar spine support the upper body weight, especially during standing, walking, or lifting. The lumbar, especially L5S1 segment, carry the most stress as it connects the spine to the pelvis. So the higher part of the lumbar, which is L5S1 lah, they carry the weight bearing the most stress area. Shock absorptions, which is main provided by the intervertebral disc, especially the nucleus purpose gel center, which compress and rebound during movement. Facet joint also assists in absorbing and redistributing force. These degenerations of herniation can impair shock absorption, resulting in nerve compression or pain. So the anatomical to absorb the shock or as a cushions is intervertebral disc. That's the function when we flexion or extend our body, and then the space of the intervertebral disc was increase or decrease. So that's looks that was like a cushions. Why biomechanical is important is to understand why back pain was happened, and then to improve the posture and ergonomies to guide rehabilitation and physiotherapists to design safe exercise or lifting technique. For the conclusions, the lumbar spine is uniquely designed to balance mobility, stability, and load distribution. These biomechanical properties are crucial to maintaining proper posture, enabling movement, and preventing injury during daily activity. This is my reference that I get to present this slide. Thank you. That's end for my presenting.
Okay, Assalamualaikum warahmatullahi taala wabarakatuh. Okay, today I will be presenting on the musculoskeletal interrelationship of the lumbar spine. We will explore how this region of the body functions as part of a complex system how these functions develop, and how they can be addressed. Now, let's begin. Okay, you see the overview of the lumbar spine. Lumbar spine is a structural and functional hub. It connects upper body, pelvis, and lower limb. It involves bones, muscles, joints, and ligament working in synergy. The lumbar spine forms the lower part of our spinal column from lumbar 1 to lumbar 5. It plays a vital role in supporting the upper body and allowing movement such as bending and twisting. It also acts as a conduit for spinal nerve that control the lower limb. Because of its central role, the lumbar spine doesn't function in isolation. It works in close coordination with surrounding muscle, the pelvis, fascia, and even the lower limbs. Understanding these interrelationships is crucial when diagnosing and treating back pain. Okay, this is the anatomy of lumbar spine. Anatomically, the lumbar spine consists of 5 large vertebrae that bear most of our body weight. Intervertebral discs between them act as cushion and allow flexibility. Facet joint guide spinal motion and help stabilize the vertebra. The spinal canal in this region contains the cauda equina. Cauda equina is a bundle of nerve roots supplying the leg. Okay, surrounding this structure are key muscles like the erector spinae, multifidus, and quadratus lumborum, all contributing to support and movement. Okay, in this picture we can see this is deep stabilizing muscle. Its role is to maintain segmental spinal alignment. Okay, this is muscular interrelationship. Multifundus is small, deep muscles critical for spinal segment stability. And the erector spine is consist of longissimus thoracis, iliocostalis lumborum, and spinalis thoracis. It assists in spinal extension and posture. Spinal extension and posture. Transversus abdominis. Transversus abdominis, the function is deep core stabilizer. And psoas major, link lumbar spine to femur. The tightness cause anterior pelvic tilt. So when the muscle is imbalanced, it will make the uneven loading and low back pain. Okay, the lumbar spine relies heavily on the surrounding muscle for stability and control. Okay, the multifidus, for example, is a deep stabilizer that protects each vertebral segment. Okay, this is multifidus. Multifidus. Okay. Okay, the erector spinae maintain posture and allow us to extend the back. Okay, erector spinae. This is the erector spinae. There are longissimus thoracis. Here. Ilicocostalis lumborum. And spinalis thoracis. And the transversus abdominis, part of the deep core, wrapped around like a corset to stabilize the spine. Transversus, where is the transversus? Here is transversus at the front, left and right transversus. This is left transversus and right transversus abdominis. Okay. Okay, and then we have the psoas major, which connect the lumbar spine to the femur. Then when it's tight, it can cause an interior pelvic tilt. When these muscles are imbalanced, the spine becomes vulnerable to overload and pain. Yeah, I show you the the where is it? Yeah, source major is connect lumbar and the femur. This is, the picture show from the back, front, and from the side. Okay, this the interspinalis is so support the lumbar. It so can fine tune vertebral motion. Here's interspinalis. This is intertransversary medialis lumbarum. This is intertransversary lateralis lumbarum. And this is psoas minor. It support the psoas major. This one is intertransverse ligament. This supraspinatus ligament is connect the spinous process of the lumbar. Okay, here at the front is anterior longitudinal ligament. At the middle is posterior longitudinal ligament. All this ligament supports the lumbar, and this ligament iliolumbar is connect from the lumbar L5 to the pelvic. Is support the SIJ joint. This also support the SIJ joint, anterior sacroiliac ligament. Okay, for the pelvic lumbar interaction, the pelvic and lumbar spine are biomechanically linked. When the pelvic tilt forward and anterior pelvic tilt, it increases the lumbar curve of or lordosis, placing stress on the joint. In contrast, a posterior tilt flattens the lumbar spine, which can strain the intervertebral disc. Weak gluteal muscle or tight hip flexor often disrupt this balance, altering how force is transferred through the spine. Okay, this is the example of the picture when anterior pelvic tilt and posterior pelvic tilt. Okay, when the anterior pelvic tilt, it will stress the facet joint, while when the posterior pelvic tilt, it flatten lumbar curve and strain intervertebral disc, like this picture. Okay, and then the facial and connective tissue influence. Okay, next, thoracolumbar fascia. Okay, next, let's consider the thoracolumbar fascia, a key connective tissue that link the upper and lower body. It acts as a force transmission system, especially during movement like lifting or walking. It connects powerful muscle like the latissimus dorsi and gluteus maximus, enabling coordinating motion. When this fascia become tight or dysfunctional, it can limit spinal mobility and contribute to lower back pain. Okay, this is thoracolumbar fascia, the green one. Okay, and then lower limb influence. The lower limb also affect lumbar function. For instance, tight hamstring can cause the pelvis to rotate backward, flattening the lumbar curve and increasing disc pressure. Excessive pronation of the feet during walking may lead to rational compensations in the spine. Even problems in the hips or knees can alter gait mechanics and put indirect stress on the lumbar area. So we always need to consider the entire kinetic chain when addressing lumbar issue. Okay, for the summary, Okay, to summarize this, the lumbar spine operates within a highly interconnected musculoskeletal system. Muscle, fascia, the pelvis, and even the lower limb all influence in its function. Ignoring this link can lead to incomplete diagnosis or ineffective treatment. By taking a holistic and movement-based approach, we can achieve better prevention, rehabilitation, or overall spinal health. And thank you. I will pass to my friend.
Welcome to this presentation of the functional stability of the lumbar spines and the muscle contraction of the lumbar. The lumbar region plays a critical role in supporting body weight, enabling movement and maintaining posture. This sustainability is made possible by the combined function of the bones, ligaments, muscle and nerve. Today, we'll be break down these components and how they contribute to the spinal stability, flexibility and long-term functional. Okay, let's start with the anatomical and muscular structure of the lumbar. The bony framework includes the 5 lumbar, L1 to L5. The lumbar is large and robust to bear the weight of the upper body. Between them, there are intervertebral discs, which work as cushion and absorb the shock. Facet joints provide control motion, while spinous and transverse process offer attachment point for muscle and ligaments. The ligament system enhances passive stability. Important ligaments include the anterior and posterior longitudinal ligaments, the ligamentum flavum and the iliolumbar ligaments, all of which prevent excessive spinal movement. Moving to the muscle, core muscle like the transverse abdominis and obliques provide dynamic stability. Bare extensors such as the erector spinae and the multifidus help maintain the posture and resist gravitational force. The deep spine muscle work continuously to stabilize the spine during movement. The nervous system also plays a vital role. The spinal canal houses and protects the spinal cord, while intervertebral phenomena allow spinal nerve to exit and communicate with the body. These spinal nerves carry critical signals for both movement and sensation, especially in the lower body. Functionally, sustainability depends on multiple factors. Load distribution is shared between vertebra, discs and supporting ligaments. Stability is maintained through continuous muscle activity and ligament tension. The lumbar spine must also provide control motion, including flexion, extension, lateral bending and rotation without compromising structural integrity. Shock absorption from the disc protect against everyday impacts, while proper nerve function ensure perceived control and responsiveness. Understanding this interconnected system is key for maintaining spinal health and managing conditions like low back pain. Okay, today we are exploring the topic of lumbar spine muscle contraction and its functional significance. Like all skeletal muscle activity, contraction in the lumbar region starts with neural stimulation. A motor neuron sends an action potential to the muscle fiber, forming a motor unit. Depending on the precision or power needed, different motor units will be recruited. This leads us into excitation-contraction coupling. The electrical signal causes calcium to be released from the sarcoplasmic reticulum. Then calcium binds to the troponin, triggering a conformational change that exposes binding on the actin filament. This is where cross-bridge cycling begins. Myosin heads attached to actin pivot, release and reset as long as calcium and ATP are present. The result, muscle shortening or contraction. In the lumbar region, several muscle groups play distinct yet coordinated roles. The erected spinae and multifidus work as extensor, strengthening the spine and maintaining the upright posture. Then, the abdominal muscle, like rectus abdominis, external and internal obliques, and psoas major are primarily flexors, helping us bend forward. The obliques and quadratus lumborum also assist in rotation and lateral flexion. Okay, we move on to functional consideration. Spinal stability, we can see the multifidus and erector spinae involved. Co-contraction, we can see muscle coordination and for support. Asynchronous recruitment to prevent fatigue. Low back pain often linked to muscle imbalance or dysfunction. Okay, for the additional support muscle, we can see example of latissimus dorsi that aids trunk stabilization, and iliopsoas group support lumbar spine and trunk flexion. In summary, the contraction of lumbar spine muscle is a fine-tuned process that support not just movement but also spinal stability, shock absorption and postural control. Okay, that's all. Thank you for your time. Bye bye.